Dr. Setlur, what's kind of your approach? As a primary care doc, yes, as you were talking about, just getting people in the door is important. How do you kind of look at things as far as women and heart disease? If you see somebody with a risk factor that Dr. Davis may have said, what are kind of the tools that we can do from primary care to help minimize that risk, or hopefully maybe help avoid having to refer to Dr. Davis if something really goes bad?
Sure. Well, one thing I see with patients every day is hypertension, high blood pressure. And, some people, say, oh, well, I didn't take my blood pressure medicine for a few days, but I felt okay. And that's an issue with blood pressure. You feel fine generally unless it's extremely high or extremely low. And so that's something I talk to my patients about, knowing what your blood pressure is, taking your medication if it is high to make sure that it's at a good level so you're not causing complications in the future.
Excellent.
And diabetes, I think I forgot to mention that.
Right.
That's very prevalent. And a lot of times you're fine until you're not fine. So it's a silent killer. It's something that you may not know about. That's why we have some early non-invasive testing that we can do. That's super easy. There's a quick heart scan that I always tell people there's no IVs. You don't take your clothes off. It takes like a minute. It's super easy. And it's a CT scan that looks to see the beginnings of heart disease that's too small to get picked up by a stress test. There are so many people that have had this that I've read it at like 7 o'clock at night, and the score is just horrendous.
And it just jumps the charts.
Right, and I've called them and I said, and they have no primary care physician. This is something that you could just order yourself. And I tell them, you don't know me, but I know you, and you don't have to see me, but I think you need to see a cardiologist. Don't be worried, but I think you have blockages in the arteries of the heart, and we need to look at that. About 20% of the time, the first symptom is no symptom. So that's why we really gotta be proactive.
On a side note, it is so true. Those things are so quick that the CT scan of the heart, I actually had mine done last week, and literally I might have counted to 60 seconds.
If that.
I mean, it was so, and when it was cost effective too at $75, I was like,
yep.
I can invest $75 in my heart.
Mm-hmm.
I would even pay the regular price, which is $150 at a lot of institutions as well too. But these are some great things. It's interesting. Is that really more so? Do you find that more so? It's interesting. I think about myself. Don't have a lot of risk factors, but I was like, hey, I turned 40. I'm going to just go ahead and see what it is. But do you find that, Dr. Davis, more so in people that may have like kind of what we call kind of intermediate risk, or do you still even say if somebody might have low risk to say, hey, you know what, why not?
Yeah, it's a very quick and easy non-invasive test to kind of risk stratify based on all your other risk factors, and it can give peace of mind because, say your score is 0, we don't see anything. Never say never, but the risk of having a cardiac event is really, really low. And a lot of times some people say, you know what, everybody in my family passes away when they're 50, and I'm like, how old are you? And they're like 49 and a half. so
yeah.
You want to give people peace of mind.
Yes, excellent. I know it's so funny for me when I got the peace of mind. The other thing that you get on the heart scan is you can actually get the rest of your chest cavity contents looked at, so they can look at the lungs and some other structures. And I go, all right, good, all right.
Yeah, and fortunately, unfortunately, we can diagnose lung cancer, breast cancer, thyroid. We're not technically looking for that, but if we see it, we'll be able to get a jump on that too. And thankfully, it's not that common, but that would have been the only way that we would have visualized it.
Well, it's interesting when you said, like, again, jumping on it, and that's really the theme, as we're talking about the fact that that people are dying for real, and I believe the most recent CDC number, and the CDC's sometimes late in publishing their data, but the most recent data I found was going back in 2013 on the number of women that died in this country, which was nearly 300,000 women that had died from heart disease in that year, of different forms of heart disease. So it is real. And so, as you said, jumping the gun. If we see something, we can jump the gun. And I think that's where we all have kind of the same mindset as prevention. The sooner you get seen, if something is found, the sooner you're likely to have intervention and get back to hopefully enjoying continued quality of life. So let me ask this question.